If Social Security benefits only rise 2.8% in 2026, while inflation stays near 3%, what does that really mean for the 71 million Americans who depend on it? Are seniors quietly falling behind, even as benefits go up on paper? Today, I want to speak with you calmly and honestly about what 2026 truly means for your Social Security, your Medicare, and your daily life. This is not just another news update. This is a real one-on-one conversation, the kind where we slow down, breathe, and understand what's actually happening beneath the headlines. The year 2026 is shaping up to be one of the most important years for seniors and retirees in more than a decade. Inflation is no longer exploding the way it did in 2022, but it also hasn't returned to the low, comfortable levels we once knew. Prices have stabilized, but they've stabilized at a much higher level. Rent is still high. Groceries are still high. Medical care is still high. Utilities and transportation are still more expensive than they were just a few years ago. And this is where the challenge begins. Social Security's 2026 Cost of Living Adjustment, or COLA, is officially set at 2.8%. That number looks positive at first glance, but when inflation remains around 3%, a 2.8% raise doesn't quite get you ahead. It simply keeps you from falling further behind. But even that idea, keeping up, doesn't always feel true, because the formula used to calculate COLA doesn't perfectly match the reality of older Americans. The CPIW, the index used to calculate benefits, is based on the spending patterns of working Americans, not retirees. Retirees spend much more on healthcare, prescriptions, and housing, and those categories have been rising faster than general inflation. That's why, for many seniors, a COLA increase feels like standing in place, while the world keeps getting more expensive around them. Let's break this down in simple numbers. If the average Social Security benefit is around $1,900 per month, a 2.8% increase adds about $53. That's not nothing. But for millions of seniors, that $53 disappears quickly. It gets absorbed by a higher Medicare premium, a higher energy bill, or just the rising cost of groceries. That's why so many Americans say, "I got a raise, but I don't see it." And they're not wrong. Now, this impact isn't the same for everyone. Some groups are hit much harder. Seniors who rely on Social Security for most or all of their income feel inflation the most. Widows and widowers often face a sudden drop in household income while their expenses stay the same. Americans with disabilities on SSDI face medical and equipment costs that rise faster than their benefits. And older seniors, those in their late 70s and 80s, often face the highest medical expenses of all. When you hear the number 71 million Americans, it isn't just a statistic. It's millions of individual lives, each with their own challenges and their own stories. Now, let's address something that worries many people: the Social Security Trust Fund. You may hear claims that Social Security will run out of money in the 2030s, or that benefits will suddenly stop. Let's speak clearly and calmly. Social Security is not disappearing. It is not going bankrupt. Even in the worst-case scenario, if Congress does nothing, the program would still be able to pay around 75 to 80% of benefits from incoming payroll taxes alone. Is that ideal? Of course not. But does the system collapse? No. And historically, when the trust fund approaches critical points, Congress steps in. Both parties know how important Social Security is. It's one of the few issues in America with true bipartisan pressure to protect it. So you do not need to fear that your checks will vanish. The real conversation is about how the system will be adjusted, not whether it will survive. Now let's shift to Medicare, because this is where many seniors feel squeezed the most. Medicare Part B premiums are expected to rise again in 2026. The reason is simple. Healthcare costs continue to rise across the board. Hospital services, medical technology, prescription drugs, all of these things cost more today than they did last year. And when the cost of providing care rises, Medicare premiums rise with it. This is where many seniors feel the greatest frustration. You receive a COLA increase only to watch part of it get eaten up by Medicare. And then there's Medicare Advantage. These plans can be helpful for many people, but the marketing around them is often confusing, aggressive, and sometimes misleading. $0 premiums, free dental, free vision, free benefits. But $0 premium does not mean zero cost. These plans often shift expenses into copays, restrictions, authorizations, or out-of-network limitations. And each year, millions of seniors switch plans without fully understanding the consequences. In 2026, it's especially important to review your plan carefully. Make sure your doctors are still covered. Make sure your medications are still included. Make sure your out-of-pocket limits haven't changed. Your healthcare is too important for assumptions. Now, let's step away from policy for a moment and talk about real life. Because Social Security and Medicare are not abstract programs. They're connected to daily experiences, the emotional and financial reality of aging in America. Rent is higher. Groceries are higher. Utilities cost more. Transportation costs more, even if you no longer drive and rely on others. For many seniors, every bill brings a small moment of stress. Every month requires a little more stretching, a little more adjusting, a little more doing without. And sometimes the hardest part isn't the money. It's the feeling of being alone with these decisions, the sense that the world keeps getting more expensive while income stays still. So what can you do heading into 2026? First, review your Social Security account on the SSA website. Make sure your earnings record is correct. Second, take a close look at your Medicare coverage. Don't assume last year's plan is still right for you. Plans change. Drug formularies change. Doctor networks change. A quick review can prevent expensive surprises. Third, plan for rising healthcare expenses. A supplemental plan or a better Medicare Advantage option may protect you from larger unexpected costs. Fourth, use every available benefit. There are discounts, assistance programs, prescription savings, and community resources that millions of seniors never use simply because they don't know about them. And finally, get clear about your budget. Not to restrict yourself, but to understand where your money goes before it disappears. Now let's look beyond 2026. The future of Social Security and Medicare depends on the broader American economy. Inflation is easing, but not back to normal. Housing affordability remains a national crisis. Healthcare costs continue to climb faster than other categories. These programs were built around a different era, but they remain central to retirement in America. And despite the challenges, Social Security and Medicare work. They lift millions out of poverty. They ensure access to care. They provide stability in a world that often feels unpredictable. Before we end, I want to speak directly to you. You've worked for decades. You've paid into these systems with every paycheck. You've lived through recessions, crises, pandemics, and all kinds of challenges. You deserve dignity. You deserve stability. And you deserve clarity about your future. Social Security is not a gift. Medicare is not a handout. These are earned benefits, built through a lifetime of contribution. As we head into 2026, the road won't be easy. But knowledge gives you power. Understanding gives you confidence. And staying informed gives you control. If you want clear, honest, and human-centered updates on Social Security, Medicare, the cost of living, and the American economy, subscribe to the channel. Share your experience in the comments. Tell me how these changes are affecting your life. Your story matters, and I appreciate you for being here. Thank you for watching. Take care of yourself, and I'll see you in the next video.